Hi everyone, my name is Mary Sampson and today we're going to do a NACOSCE station on breaking bad news. This is for educational purpose only. Here's a clinical scenario. Mrs. Smith is a 55-year-old woman who has been experiencing persistent abdominal pain for the past few months. After undergoing various tests, including imaging studies and biopsies, the results have confirmed a diagnosis of advanced pancreatic cancer. Task: discuss the results with the patient. Address any patient concerns. You have 11 minutes. So for this situation, you will use the SPIKES framework. Situation, perception, invitation, knowledge, empathy or emotion, strategy, and summarize or summary. So it is good to write the mnemonic on your notepad to organize your thoughts as you read the case on the door. You usually have 2 minutes in between cases. So at the beginning of your encounter, you will knock and enter, sanitize your hands, make sure you smile, and then you sit and start your encounter. So first, you're going to set up the situation by introducing yourself and also by confirming patient details. For example, you can say something like, "My name is Dr. Sampson, and I am one of the doctors in the clinic today. May I confirm your name and date of birth? How are you feeling today? I have your results back and I will be discussing them today." Then you will go into perception. So you will assess what the patient understanding is of the current situation. You will ask open-ended questions. So for example, what brought you to the doctor initially? What symptoms were you having, Mrs. Smith? What is your current understanding of your situation? Do you know the purpose of the biopsy done? Then you will go into invitation. So invitation to disclose the information. You want to check if the patient wants to receive their results during the encounter and how they would like to receive them. If they say yes, then you break the news in a simple and straightforward manner and give time to the patient to react and absorb the information and also offer support. For example, "Mrs. Smith, as I mentioned, I have your results with me now. Are you happy with me discussing them with you? Would you like me to go into details about the results or just give you enough information? Mrs. Smith, I'm afraid the results are not good." So by saying that statement, by making that statement, you are giving like a prompt, like a warning. Then you can say something like, "They show you have advanced pancreatic cancer." Okay, next. Now we're going to go into knowledge. So as you just delivered the bad news, you continue in giving more information about it. So you pace yourself and make sure you give the information in small chunks. Pause if you need to, allowing the patient to process the information to absorb the shock. And explain what the diagnosis is and the general treatment, then respond to any question they may have. For example, you can say, "I'm sorry to break this type of news to you today. What is your understanding of pancreatic cancer?" And you can say something like, "There are various treatment options available to you. I will refer you to an oncologist who will tell you what is the next step." Very important, repeat the information if needed. Also, do not interrupt the patient as they talk. Now we're going to go into empathy and emotion. So you acknowledge patient's emotion and respond in an empathetic manner. Address any patient's concern or questions. For example, "Mrs. Smith, I understand this is not the news you were hoping for, and I know how devastating what I have said must be. Is there anyone you would like to have with you at this time? Do you have any concerns or questions?" And you allow the patient to express themselves. Make sure you don't interrupt them as they talk. And after the previous step, you go into summary and strategy. So you explain the next step to the patient or treatment plan. Have the patient summarize information given to assess their understanding. Involve the patient in the decision-making process. So for example, you can say something like, Mrs. Smith, I know this is a lot of information to process. I'll give you some information about your diagnosis for you to take your time and read through. There are lots of support services I can refer you to that you can benefit from. The office will also schedule an appointment with a cancer specialist and will inform you of the date. You can call the office anytime if you have any questions or concerns. How does that plan sound? By asking this question, how does the plan sound, you are involving the patient in a decision-making process. And then you can say something like, did you understand everything that was discussed today? What are your thoughts? Do you have any other questions, concerned at the moment? Key points to remember when you are breaking bad news. Always talk in layman's term, which means break it down as simple, in the simple language, as simple as possible. Do not interrupt the patient when they talk. Make sure to pace and pause while delivering the news. Be honest when answering the patient's questions. And do not give false hope or false reassurance to the patient. Your goal is to deliver the news in a sensitive manner while ensuring Mrs. Smith feels supported and informed about her condition and the next steps in her care. And that is how you break bad news in a NACOSCE station. Thank you.